Next, we are going to study about scleral lens fitting. Scleral lens fitting, if 4 steps are approached: choose diameter, establish center and limbal clearance, landing zones alignment, accurate edge lift are the 4 steps of scleral lens fitting. Next one is optical clearance or clearance zones diameter. Optical zones important to provide good optical outcomes and corneal clearance. Clearance zones, optical zone plus translational zones, usually 0.2 mm larger than horizontal vertical iris diameter. Size depend on lens design, can be altered to improve corneal and limbal clearness. Next one, lens insertion with a initial diagnosis leads held concave side up. Instill saline solution into the lens and add the small amount of fluorescent. Tilt the patient head down and center apply the lens so the solution remains in the lens. Use cobalt blue filter to accurate evaluation of fluorescent patterning. To determine the amount of clearance, use the slit beam to view a contact lens reservoir and cornea in cross section. Next one is central and limbal clearance. Up to a 600 microns of corneal clearance can be easily achieved if needed centrally. Clearance of 200 to 300 microns is usually considered sufficient, but this is easy. Go up to 500 microns if desired with the end stage large diameter lenses. The term flat and steep are subtitled with increase or decrease in subtitle height instead. Increase the surgical height of the lens, causing a lens to lift off the eye. Increase the clearance and fault of the lenses. Surgical depth differ with the condition. Aesthesia needle a larger than the post-corneal graft. Corneal suffers disease management require large surgical height. Central and limbal clearance evaluation start with low surgical height and gradually increase the height to desired clearness and a green fluorescent pattern will be visible. Use to thin optical section of bright illumination setting at the 40-degree angle. Use CCT nose. Compare the corneal thickness of tear lens thickness to estimate clearance. If the CCT not assumes a 530 microns center cornea and 650 microns in peripheral, roughly 2000, and compare to the slit. And limbal clearance complete. The Joyous limbus clearance is necessary to ensure the tear circulation to prevent the erection damage of the limbal epithelium. If very little fluorescence is observed in the limbal area of the lens, then the lens should select in large diameter. Scleral lens with complete limbus clearance, and second diagram is clear lens with inadequate limbus clearance. Next one, landing zone alignment. The landing zone should rest even on the scleral conjunctiva with the edge appear just above the conjunctival epithelium. The lens should not move with blinking. Moving lens cause discomfort to the patient. Can correct it by the tightening the landing zone. No fluorescence will be visible under the well-fitting landing zones except at the edge. The ring of bearing on the near part of the large zones indicates the flat landing zones. A ring of bearing on the outer part of the landing zone indicates the steep landing zones. Increasing the size of the landing zones relieve the pressure if needed. And lens edge lift. Assisting lens edge lift after 30 minutes of the lens installation during fitting procedure. Also assist lens edge after 3 to 4 hours of the lens wear. Too much of edge lift cause the lens awareness and discomfort. Action: decrease the edge lift by changing the landing zones angle or by choosing a small landing zone radiation of curvature. Low edge lift, leaving a full or partial ring of on the conjunctiva after lens removal. Too easy method: observe the edge lift with white light, how much it sink in the conjunctiva. Push in method, perform perform if the lens shows some mobility. Remove lenses and evaluate suffers with fluorescence staining. An adverse effect: bubbles. First one, due to lens insertion of fitting procedure can cause dry spot or corneal surface produce a bubbles. Fluorescent fill up the empty spaces, cause pooling after vision or at visual axis. Conjunctival balancing. Compression of the conjunctival blood vessels for a transitional stool pressure. To make less pressure flat by increasing transitional stool diameter. Corneal hypoxia due to overnight wearing. Advise patient not to sleep with scleral contact lens, even high decay. And immense staining causing a steep landing zones. Those pressure in conjunctival blood vessels cause the bulbar hyperemia. Action: change the flat landing zones. Lens deposits, tear containing deposits trapping bending the lenses. Lens adhesion to conjunctiva. To remove until eye drops, move it and remove lenses. Can cause decreased corneal sensitivity and epithelium defect. Patient complication, hygiene. Clean kit, same to RGP, must use protein clearance if deposits on lens present. First see giant papillary conjunctivitis. Sleeping with scleral lenses. Patient love to wear lens overnight. Advise patient not to wear scleral lenses extensively to avoid complication. Future scleral lenses. Would consider scleral lenses is future yes. Good alternative or irregular cornea, less complication, better corneal health. And future scleral lenses are low vision aids, more plus power, large optic zones and easy to handle, cost cheaper than the current cost, so that many people can afford and benefit. Material, better material, thus scleral lenses can be worn overnight and extension. Availability, easy to obtain in market. More expert able to handle the fit and education public. Scleral lens advantages and disadvantages. More parameters are available. Thank you.